changing gears, if I may, Dr. Sidler, I am seeing, I don't know what your experience is or others on the panel or listening, I'm seeing more and more people wearing masks, and many of those are people outside. Is this part of the, I won't say hysteria, but the overly concerned syndrome with COVID-19?
Yes. Yes, it is. The preponderance of evidence is that masks don't work, that they have little or no effect on the individual acquiring the COVID virus or spreading it, either way. And the very few studies that, very early on were cited as a reason to do masking were studies in hospitals where people are exposed repeatedly and in high exposure to the virus, and those were with the N95, the very high quality, very high filtration masks. And in a few of those studies, there was some evidence that wearing the masks was beneficial, protecting the healthcare workers. Later on, bigger and larger studies seem to suggest that may not have even been true itself, but that's not what we're talking about here in the general public. When you're out in the general public, you're not being exposed close to people that have COVID on a repeated and constant basis for hours and hours at a time. And the people you see wearing the masks, probably most of those aren't the N95 high-quality masks to begin with, which, again, are worthless.
Yeah. If you notice, Moderna's running commercials now about how important it is to get another booster shot, which is what, 1,212? I don't know.
Yeah, well, the only booster available right now is that what we call the bivalent booster, which includes the original strain of COVID, the coronavirus, and the first generation of the Omicron variant that came out in November of 2021 was the first that we heard about that. We have now gone through, more than a dozen, I think it's closer to 20-some subvariants that have mutated and become significant variants of the coronavirus since then. And and you can see this in most articles that are talking about the current variations that are out there, that the ones that we've been talking about now, and they don't seem to have any sensitivity to the antibodies that we get with the vaccine, that the vaccine is relatively worthless against those. So now they are going to come out with a new vaccine here within the next month or two. I think both Pfizer and Moderna have an updated vaccine coming out that is targeted toward the original strain plus now one of these later variants. But again, there have been several more variants that have come and gone since the one that's going to be in the new vaccine, and so there's questions whether this one will be any better.
Well, I think in a previous conversation you weren't high on recommending people get it, because it seems like people who have been vaccinated are still getting it, but the argument on their defense is that they're not getting it as severe because they have had the vaccine and they don't get it as severe once they get it. I don't know if there's been any studies to verify that belief, but that's what we're hearing.
Well, that still may be true. We don't know for sure, because the few studies that did show that were earlier on, when we had some of the earlier variants that were probably closer related to the ones that the vaccine was formulated out of. Now, if we studied that particular subject, are they more protected? We may not find that was the case. We just don't know, because these things keep mutating so rapidly, and now like I say, we're on to variations. the studies just haven't been done yet to tell us that. We do know that right now, most of the people getting COVID, most cases, are in people who have been vaccinated, about 80% in some studies of new cases are in people who have had at least the initial vaccination series and some with the later booster. That's quite impressive that those are the ones that are getting it, which just pretty much means that the immunity isn't helping you much against these newer variants.
Doctor, I have a quick question for you before Roger comes in again. Have we gone away from the way we used to test vaccines? Are we just now all of a sudden accepting whatever is brought out quickly?
Well, indeed, all of the vaccines that have been approved in this country have been approved through a shortcut, the emergency authorization program by the FDA and CDC and National Institutes of Health. They did not require as full and as lengthy of studies as usually the case for a completely new technology, this mRNA technology. So we're still learning things about it, and there are still ongoing studies about it. But the booster, the one that doesn't include the Omicron strain, what we call the bivalent booster, that one was studied on a very small population of individuals and then rushed out to the public. We're still learning about side effects and long-term effects. You hear about the long COVID. There's some question that maybe some of the cases that we're seeing that are being termed long COVID may indeed be related to some kind of an autoimmune reaction that may have been triggered by the vaccine itself, by the mRNA vaccine.
That's very concerning, obviously.
It is. Again, I'm not saying that that's been proven. That's not been proven. We just don't know because there's just not been enough time to study this carefully because it's a completely new field here, new area.
I'm sure the flu was like this long time ago, and they still took time to figure that one out. And, it's always a guessing game. So I guess I wonder why we're still jumping to conclusions on this. If it's not as deadly as it used to be, why are we not going through the proper channels to get it done?
Well, that's what I've been saying up till now, is that with these newer strains being so different than the ones that the vaccine protects us against, and again, younger and healthier people not being susceptible as much or having as serious of a consequence when they do get infected, that we should be focusing vaccination efforts pretty much only on those people with multiple other health issues, the people at highest risk. Young people, especially children, I don't think should be getting this vaccine. The chances of them becoming very sick or dying from the COVID are significantly lower than the risk of side effects or serious issues with the vaccine itself.
Yeah, as it turns out, they were really pushing even down to 6 months, for crying out loud. And I don't know whether that movement succeeded or not, but my understanding is too many parents were very, very hesitant to proceed.
Yeah. Hey, by the way, the U.S. Basketball team.
Yes. What was the score? Well, Dr. Fauci is in the news. Let's start with a little medical news. We're going to get into sports as well. Interesting, the New York Times, which is not exactly a conservative newspaper like Fox News, had a scathing headline in a story: the mask mandates did nothing. Will any lessons be learned? And Dr. Fauci says he sure hopes that people start wearing masks. What's your take on this?
Well, yes. I mean, we've been seeing in the news that not only Dr. Fauci, but a number of government officials, both at the state and local levels, are making hints that we should bring back mask mandates. Now, this is all because there has been a slight surge, a slight increase in the number of cases of COVID with these latest couple of new variants that are showing up, the BA 2.86 and the EG5 variants that we talked about a little bit the last week or two on the show. But these are subvariants of the Omicron strain that first emerged back in November of 2021. For the most part, the Omicron strain of the virus has not been particularly severe and harmless. There was a high surge of new cases when that first appeared, mostly because it seemed to escape the immunity that people had from the vaccine. And so, we now have the bivalent booster that came out a couple of months ago that incorporates an effect from the Omicron as well as the original strain. But even since that new bivalent booster came out, we've had several more generations of new variants from the Omicron that have come and gone, and we don't seem to see that even the ones now present are very well covered by the bivalent booster. So, there's talk of bringing back some of these restrictions and mask mandates. There have even been a couple of states that have passed laws in the state banning mask mandates. I think Texas, Arkansas, and a couple of others have passed some laws. Now they apply only to, I think, government buildings and government organizations. Because I think the courts have ruled that they can't mandate things for private companies. But we're going to see a little bit of a fight over this. One study I saw said that 70% of Americans say they will not comply with any new mask mandates. And, getting to the real heart of the issue, as you've mentioned and Terry's mentioned on the news reports, is that they haven't been shown to be effective. And back earlier this year, that Cochrane study that you have been talking about reviewed all of the double-blind and randomized controlled studies, compared them with earlier studies which were not randomized and controlled, and found that in none of the ones that were the good studies, the reliable double-blinded and controlled studies, none of those showed any positive effect from mask wearing. Now, when Dr. Fauci, it's interesting because Dr. Fauci was on one of the Sunday talk shows, and he was actually confronted by a CNN reporter about this review study that showed that the masks just weren't effective. And instead of admitting that may be correct, he shifted and pointed to some earlier studies that were not very well done studies that seemed to suggest that the masks were effective, and now we know that those were very poorly done studies and probably not reliable. So he doesn't seem willing to accept that the masks aren't effective, and fortunately now he's retired. He's not in a position to, I think, have any authority anymore. But we still have people in government agencies like the CDC and in state agencies and in city agencies that seem to think that they can control things by passing more mask mandates.
The wearing a mask is an interesting phenomenon today because there are people, and we see them in stores. I've seen people outside wearing masks, and I'm not going to ridicule them or criticize them. If they feel comfortable wearing a mask, wear the mask. But the idea of mandates, and they're doing that at some universities and colleges and even some hospitals, as we pointed out in our newscast, that I don't understand.
Yes, hospitals especially, I think you'll see many of them requiring masks now and still. Universities, there was one university that actually backtracked and took down their mask mandate after there was a sort of blowback that went against it. It's hard to know where this is going to go from here. Ohio Senator J.D. Vance just introduced, or apparently is about to introduce, a federal measure banning the imposition of mask mandates in schools and on airplanes, and we'll see if that gets support from both sides. Somehow I think it either won't get enough support, or some court somewhere will take it down. It's just amazing how these things work. But yeah, considering all of the harm that masks has done, and we've all read and we've talked about how it's affected children and interpersonal and social relationships, and just a whole number of negative effects that have come from mask mandates, not the least of which was a recent studies that there are chemicals that are used to process both the cloth and paper fiber masks that when you put them up against your face, you're breathing that constantly for hours, and that could have negative effects to the human physiology. We just don't know about a lot of this, and our body wasn't designed to have a mask that's strapped over the nose and mouth and breathe through that kind of thing. There's negative effects from this that, for some reason, these people passing these mandates never even consider.
I know. I saw a woman in a restaurant who came in wearing a mask, ordered food, sat down, and pulled the mask down, would take a bite out of her burger, and then put the mask back up. But you know what? Well, if she feels comfortable doing that, exactly. More power to her.
That's exactly what it boils down to. I think it should be people's voluntary choice. There should not be any legislation requiring people to wear these things.